My name is Instructor Kenneth Gilland with the Vicksburg Fire Department, serving as a lieutenant I have 8 years of service. Today, I would like to talk to you about bleeding control. Today, we're going to learn about the differences between a life-threatening and non-life-threatening bleed and how each one can be controlled. So, what are some of the differences between a life-threatening and non-life-threatening bleed?
A finger cut?
A finger cut. A finger cut would be a non-life-threatening bleed. In your ABC process, a finger cut, you would still worry about your airway and breathing before you would a finger cut. But a spurting arterial bleed, something that's not oozing, that needs to be controlled immediately with direct pressure and/or a tourniquet. We're going to learn about both today. So, bleeding control is an external hemorrhage, blood coming out of your body visibly. Your body is not able to tolerate a blood loss of about more than 20%. At that point, you might start seeing changes in your vital signs, level of consciousness. So, bleeds need to be addressed quickly and efficiently. We control bleeds with direct pressure, the use of pressure dressings, and tourniquets. When you control a bleed with direct pressure, if it cannot be controlled with direct pressure, you would do what? You would use a tourniquet. So some of the examples of like pressure dressings that I have here, this is an ABD pad. So if I have somebody bleeding from their arm or something, I may apply this to their arm. Use direct pressure because that's what's going to initially stop your bleed. It's like plugging a hole. You apply direct pressure until the bleed ceases, and you can bandage it with Kerlix, wrap it with, seal it off with tape. Apply additional direct pressure as needed in the situation. A minor cut, you may be able to just control that with a little direct pressure and a 4x4, some tape. So direct pressure stops the flow of blood and permits normal coagulation to occur. So if the flow of blood is stopped for long enough, it begins to coagulate, it'll stop on itself. It'll start forming a scab, basically, is what we think of when we think of that. Direct pressure is the most effective way to immediately control a bleed. Also, you always want to use your standard precautions. We're using PPE. We're looking out for hazards. You want to apply direct pressure over the wound with a dry, sterile dressing. And you want to cover the entirety of the wound. So you will cover the wound. You will cover the area just above the wound and below the wound. See, cover the entire dressing above and below the wound. Apply manual pressure and additional pressure as needed. Applying a tourniquet. So when direct pressure is not enough, we apply a tourniquet. If I could, I will get my assistant to come up here and I will demonstrate the use of a tourniquet. So this is a standard cat tourniquet. This is what we use most often in EMS. Police, firemen, plenty of people carry these. So if you have a bleed on your arm, lower forearm, or anything here like this, you would apply this. You want to do 90% of your work at jump. So when you first apply the tourniquet, you do 90% of your work off the bat by pulling it as tight as you can. All right. All right, now once that's applied, you will do the remainder by twisting this. It shouldn't take more than 3 twists. See, I believe that I just did 2 right there. You can assess for distal pulses. Hers are no longer present. And you will also visually see blood flow stop. You know your pulses are gone down here. Your blood flow is visibly stopped. This is successful. If one tourniquet is not sufficient in the case, you can apply an additional tourniquet. I'm going to go ahead and release this from her because I know this is uncomfortable. Now, once the tourniquet is applied, bleeding is controlled. A good practice, you see you have this strip right here. It says time on it. When a tourniquet is applied, you need to write the time it was applied right here. That lets them know how long the tourniquet has been on, because when oxygenated blood is no longer flowing to that limb, cell death is occurring. And your blood starts to become toxic. You could get compartment syndrome in that extremity. And once the time's written, you know, we're packaging our patients. We're loading them on the stretchers. We're treating for shock, so we're covering them up to keep them warm. In that case, something might get lost in translation with this patient being moved from one person to another. Somebody that receives this patient may not realize that they have a tourniquet on them. So a good practice is to, after this is applied, you take a Sharpie and you can write a T on their forehead, because we don't cover up their heads. So whenever a level of care sees that T on their forehead, they know that this patient has a tourniquet on them somewhere. So like I said, you click the buckle into place, pull the strap tight. Turn the tighten dial clockwise until pulses are no longer palpable. And bleeding has been controlled. Now, given this information, we should know how to apply direct pressure and a tourniquet. Direct pressure is a pretty universal term. Tourniquet is pretty straightforward. So, are there any questions?
I have a question.
Yes, sir.
Can I use a belt for a tourniquet?
Yeah, I mean, if you were in dire straits and you had nothing else, a belt would be better than nothing. You could occlude blood flow because it is applying pressure. Tourniquet is the most effective way to completely stop, and you know, direct pressure is always our go-to because it's always readily available. Now, what are some reasons why I need to notate my time on a tourniquet patient?
Yeah, why would you?
Because of worries like toxic shock or compartment syndrome, because and the cell death from blood flow, oxygenated blood flow being cut off from that extremity. It's pretty straightforward. Also, after a patient's tourniqueted, still dress your wound. You stop the bleeding primary, secondary, you're still going to dress that wound, you're still going to put a bandage on it, you're still going to put a pressure dressing on it. But I believe that covers everything on direct pressure and tourniquet use. Once again, I am instructor Kenneth Gilliland, and I thank y'all for y'all's time and y'all's attention.